The topics I choose is about cultural training, and my objective is cultural awareness training reduce discrimination, but it also has some limitations. My evidence for source one is cultivating self-awareness may prevent our bias from getting in the way of how we serve customers from different cultural backgrounds. In order to best help individuals from multicultural backgrounds, career survey professionals need to know and understanding themselves deeply. The first step in understanding oneself is to acknowledge one's conscious or unconscious attitude, stereotype, and prejudice about another group of people. Everyone is at least a part of a culture. The contingency of this culture shape client behavior that may or may not be acceptable or familiar to career service professionals from another culture. By recognizing the importance of culture, vocational survey professionals have achieved socially meaningful goals, such as reducing inequality in survey access and improving the quality of surveys for the multicultural population in the field. Vocational survey professionals also have a legal and moral obligation to provide equal opportunities to multicultural population and not to allow their bias to influence their judgment and ability to provide survey. Career counselors and practitioners are encouraged to play a role as multicultural advocates to discuss and address social cognition suggests that we may be challenged with 11 million pieces of information at any given moment. Since the human brain can only efficiently process about 40 items, it relies on shortcuts and past knowledge or experience to make safe assumptions. This leads to unconscious bias, often referred to as implicit bias. Implicit bias refers to attitude or stereotype that affect people's understanding, action, and decision in an unconscious way. These bias, which include favorable and unfavorable evaluation, are activated involuntarily without the individual's awareness or intentional control. Culturally aware assessment practice allow career professionals to gain important cultural information about their client to understand their work well. Cultural awareness assessment also allow behavioral analysis to identify any potential cultural barriers, such as way of communicating and expressing emotion. And here is my evidence for source 2. The Bachelor of Nursing at the University of Western Sydney has incorporated Aboriginal health into an undergraduate program, with the expectation that students will become aware of Aboriginal health and health issues. To gain insight into student perception of Aboriginal and whether the curriculum learning and teaching strategy implemented have improved student learning outcome and attitude toward Aboriginal Australia and Aboriginal health. Students enrolled in Aboriginal health in 2013 were invited to complete a current and post-course survey. 502 students completed the baseline survey and 249 students completed the following up survey. Attitude toward Indigenous Australia as measured by the ATLA scale changed statistically significantly with participant knowledge of Indigenous Australian, intention to work with Indigenous Australia and confidence in caring for Indigenous Australia increasing significantly in subsequent survey. In some cases, the learning experience gained by the unit have made students aware of the importance of history to the lives of Indigenous people. For some students, this prompts a change in attitude and a desire to seek opportunities to interact and work with Indigenous Australians. In addition, they report that Their learning experience in the unit reinforced their professional requirement to respect and value cultural diversity in the provision of the therapeutic care. The study showed that completion of a unit dedicated to Aboriginal history, culture, and health improved negative attitude, increased nursing student overall confidence, and increased their desire and knowledge to work collaboratively with issues facing Aboriginal people. Not surprisingly, education plays an important role in challenging negative attitude, helping to break down misconception and stereotype, and increasing nursing student knowledge and respect for a culture that's experienced significant adversity. My evidence for source 3. An analysis of the literature on cultural competency revealed two main drivers of cultural competency: social cultural factor and their impact on healthcare access and healthcare disparities. Since these are questions that drive cultural competency, they should also be questions that cultural competency is designed to change. However, although these drivers are central to cultural competency, they have not been consistently addressed in cultural competency intervention approach and assessment. In the context of cultural competency training, issues surrounding cultural difference are confused with those relating to larger structural disadvantage such as racism and discrimination or poverty. Of particular concern is the fact that the issue of unequal power as manifested by institutional racism and racial discrimination or bias in healthcare is overlooked because of the focus on culture and cultural difference. To address the inequality experienced by ethnic minority and minority population, healthcare provider and systemic racial bias are key considerations. Although racial prejudice have an impact on the healthcare gap, there is little evidence that cultural literacy training addressed the problem. Instead, it focused on the culture and the identity of the patient. Among healthcare system level intervention, there are some reports of improved relationship between provider and patients and increased patient involvement in their healthcare. One study found that greater cultural competency will positively correlate with customer care experience, including physician communication, overall hospital rating, and hospital referrals. However, there is a lack of assessment of the impact of cultural competency intervention on the communication dynamic and decision-making process. My evaluation of evidence, the pro for source 1 is this article explains implicit bias in great detail, and the con is this article lacks a detailed example to help reader better understand the consequence of lack of cultural awareness. My pro for source 2 is this article gives a good description of the experimental result described in the article. And the con is due to the limited number of participants, the experimental results in this article may not reflect the learning outcome and attitude toward Aboriginal people and Aboriginal health issue of all Australian students. And my professor 3 is this article outlines in great detail the lack of cultural competency and give advice on how to improve it in the future. And the con is the strengths of the cultural competency written about in this article are too vague. In conclusion, although cultural competency training can be appropriate to reduce racial discrimination, such as reducing unconscious attitudes that lead to unfair treatment and positive improvement in the treatment of indigenous people by those exposed to the training. However, cultural competency also possesses deficiencies, so this training alone is not sufficient.